Michigan's Medicaid program on the verge of expansion. Thanks for joining us tonight, everyone. I'm AJ Hilton. Governor Snyder is behind the proposal which would allow hundreds of thousands of people who don't have insurance to visit a doctor's office. The federal government will pay for 100% of the cost of expansion for the first 3 years. Fay Lee explains how the governor plans to pay for it after that.
Governor Snyder is tight-lipped about the details of his fiscal year 2014 budget recommendation, but revealed one major piece of it.
We're all here to support the expansion of Medicaid, and that's the message I'll be making tomorrow in the budget message.
He was applauded by an audience of healthcare and business professionals at Sparrow Hospital. The proposed Medicaid expansion will cover those making up to 133% of the federal poverty limit, cutting the number of uninsured Michiganders by almost half and reducing the burden on hospitals.
Those that are uninsured, they're using the emergency room as their primary health care mechanism. That's a flawed system.
But the governor's recommendation hasn't received the go-ahead from House Republicans, with House Speaker Jace Bolger remaining cautious and concerned.
If the federal government were to tell us that they will cover 90% for many years and then at some point change their mind and not fully fund the program that they want us to get involved with, then that would fall on Michigan's taxpayers to cover, and we have to be concerned about that.
Governor Snyder came up with a plan to start setting money aside. He says the funding from Washington will allow the state to save some of its general fund, and he wants half of those savings to go into a health savings account.
So when we have to start paying our share of the Medicaid expansion, we can start drawing those dollars down to sort of smooth out the effect of having that take place.
In Lansing, Fay Lee, Fox 47 News.
Governor Snyder says Michiganders won't have to pay anything for the expansion until 2035 because of the savings account. It's still unclear if and how much the expansion will cost taxpayers. Medicaid coverage will include access to primary care doctors, preventive care, and routine checkups. Governor Snyder will be giving his budget recommendation Thursday. We will have coverage from down at the Capitol, and we'll also break down how the governor wants to spend your money tomorrow at 5:30.